Welcome, everyone, and we're so excited to have this group gathered today. My name is Zandra Hawkins. I'm the Executive Director of Granite State Progress and a leader in the New Hampshire Healthcare Coalition. We're excited today to talk about the Build Back Better plan and how it will lower costs and expand access to healthcare in New Hampshire and across the country. The healthcare provisions in the Build Back Better plan are some of the most significant health reforms in the last decade. This bill allows Medicare to negotiate lower drug prices, expands Medicare benefits to include hearing, closes the Medicaid coverage gap, and dramatically lowers the cost of health insurance for millions of Americans. Representative Pappas has been a vocal champion for Build Back Better and the healthcare reforms specifically, delivering on promises he made to constituents to fight to lower prescription drug costs and expand health coverage. On behalf of our organization and so many families in New Hampshire, we'd like to thank Congressman Pappas for his steadfast leadership and commitment. In a moment, we'll hear from some of the Granite State families who've actively urged Congressman Pappas to lead on prescription drug reform and healthcare reform. But first, I'd like to invite the Congressman to talk to us a little bit about what's in the Build Back Better plan passed by the House and what we can expect in the weeks ahead in the Senate. Congressman Pappas.
Well, good morning, Zandra. Thanks very much for organizing this and for convening this group here today. I hope everyone is doing well and staying safe and had a great Thanksgiving and hopefully looking forward to a nice holiday season too. It's really great to be with you here today. You know, as I travel around New Hampshire, there are no more significant stories that I hear than coming from constituents who are concerned about the high cost of prescription drugs, about access to healthcare, about ensuring that healthcare is affordable and within reach for their families. And so, you know, I'm someone who fundamentally believes that healthcare should be a right and not a privilege in this country, and that we have additional steps to take to make sure that our healthcare system works for people, that it's improving outcomes, and that healthcare coverage and prescriptions are affordable. So the stories that I hear from folks like the ones gathered here today are, I think, impacting the debate here in Washington. We just passed through the House a significant package called the Build Back Better bill, which includes a few provisions that we'll talk about today. But I think that, you know, folks in New Hampshire and across the country have been frustrated for a long time about the high cost of prescription drugs and about the lack of action to make that situation better. And I'm really pleased that we've got a bill now that really takes a huge leap forward when it comes to drug pricing in this country. It's really comprehensible that in a country as well off as ours, that access to affordable medicine is treated like a luxury, and that pharmaceutical companies are allowed to jack up prices and continue to reap record profits at the expense of Granite Staters and folks across the country who can't afford prescriptions. There's no reason that this should be a reality for so many. And the drug companies who have gamed the system for years have done so at the expense of patients and Granite Staters. And I think folks across the country are fed up. So we are starting to make some progress because the Build Back Better Act has some critical provisions contained in it that are going to significantly bring down the cost of prescription drugs and also lower healthcare costs. That's important to so many families across the state. The bill will allow Medicare for the first time to negotiate prescription drug prices. This is a carve out that the drug companies have had for years, and it's time we brought that to an end. By negotiating lower prices with the drug companies, there's not only a savings for the Medicare program and a benefit to Medicare enrollees, but those competitive prices can be shared across our healthcare system. So this is really good for the country. The bill will also prevent drug companies from raising prices faster than the rate of inflation. We know we pay the highest drug costs here in the United States than any other country in the world. We're also the home to innovation. And we've got to make sure that as we unlock life-changing and life-saving medications and treatments, that people have access to them. The way we do that is by controlling the rate of inflation and the cost escalations that families just can't afford. This bill will also cap out-of-pocket costs for seniors who are on Medicare at $2,000 a year. That's really important for folks who might be taking multiple medications and just are hit month after month with a really big bill. This would hold that for seniors to $2,000 per year. And then the issue of insulin, which I know we'll hear a little bit more about later from one of our advocates. this bill will cap insulin costs at $35 a month. Now, this is a drug we know that has been around for a long time, and we know that the price spikes we've seen for insulin just don't make a lot of sense, given the fact that this is a drug that so many need, that there isn't a lot of new development around. So capping it at $35 is really going to make a difference for New Hampshire families and folks who need insulin. We're also going to see a reduction of premiums in healthcare plans. We were able to pass the American Rescue Plan earlier this year that for the next, for one more additional year, we're going to see premiums reduced on the exchanges. This bill will continue those premium reductions in a way that's going to result in savings for families. This bill also looks to close a gap in coverage nationally, which is important. We know in New Hampshire, as we expanded Medicaid, that if everyone is getting covered, if people are getting preventative care and are focused on their wellness, that we're all better off across our communities. And one more thing that I'll mention is that the bill expands Medicare to cover hearing services and hearing aids. That's something that's really important for the program. It's something I hear a lot about from New Hampshire seniors. So as it pertains to healthcare, this bill is all about bringing down costs, making sure that our healthcare system is working for New Hampshire families. And I'm just really hopeful the Senate will take it up as soon as possible so we can get this bill signed into law and the benefits will start rolling out for families all across this country. I think the reforms are going to be a real lifeline for Granite Staters. I fought for many of these changes my entire time in Congress. I've campaigned on them when I first was running for office. And I know that these changes will help level the playing field for those who are struggling to afford prescriptions and are worried about the high cost of health insurance. So I think this is really a once in a generation opportunity to get these reforms done, to get it right, to lower costs. And I'm just pleased that we're at this point. And I have to say that we wouldn't have gotten here were it not for folks who are stepping forward to tell their stories about their interactions with the healthcare system, about the high cost of prescription drugs and how that impacts their families. It's about time that their voices help produce a law here in Washington. And so thanks again to the folks who are gathered here today to shed a little bit more light on these issues. To Melly, to Robin, and to Bevy, thanks so much for being a part of this. And Zandra, I'll turn it back to you.
Thank you. And thank you again for your leadership here, particularly making sure that prescription drug reform remained a top priority in Build Back Better, because we know that there were a lot of forces that wanted to take it out or water it down. And we really appreciate how much you've championed healthcare overall, but particularly this piece. As you mentioned, Americans pay more for prescription drugs than anyone in the world. And it's completely unacceptable that we pay 3 times more for prescriptions than people in other countries. So we're glad to see Congress doing something about it. We have with us today 3 Granite State moms who've been a part of raising the urgent call for action to lower prescription drug costs and expand healthcare. I'd like to invite first Bevy Cattell of Madbury to share a little bit about her family's experience and what they're excited about in Build Back Better. Bevy's son, who actually will be joining us today, has diabetes, and it costs hundreds of dollars a month for his insulin. So Bevy.
Yes, thank you very much. And thank you, Representative Pappas, for your hard work and your consistency. And, we all are, indebted to you because you're staying in front of this. One challenge I am excited, maybe ending soon for our families and others, is that rising cost of insulin is going to stop. John happens, my son, John, he got diagnosed with diabetes at age 3 and he's 10 now. And believe it or not, today, this morning, yesterday morning, I think the prior morning, we had an insulin issue. But anyhow, he happens to be here and maybe it's meant to be, but he's going to say hello real quick. John, can you guys see him? Say hi.
Hi, John. Thanks for being with us.
Yeah. He's kind of curious how we advocate, because I told him this is about him and millions of people. So Representative Pappas, I cannot be more appreciative that you're here and the other moms are here. Insulin's been around since 1922, right? And yet in the last decade, pharmaceutical companies have tripled many brands of insulin. And in some cases, the prices have risen 800%. I can tell you in the last 3 months how I've had quite anger. Is it 4 months now? Probably 4 months since we had to change insurances, and the difficulty it was to get our co-pays, all the administrative stuff. But I need to use that anger and continue to advocate and to form groups and be with people like you, that we all have the same voice. So, you know, the last time we got together, his insulin cost was like $125 per week. Now it's up to $525 per week. You know, health insurance helps brings that down, but that's not the case for most people. And it doesn't have to be this way. And it's why advocates like myself have been speaking out about the insulin cost crisis, and why we're thankful for leaders like you taking action to make insulin and other widely used medications more affordable. One way that we can do this, of course, is by empowering the government. I think it's the main way, it's the only way. The government needs to negotiate for lower drug prices on the behalf of patients like John, and make other bold reforms to stop price gouging by these pharmaceutical companies. This Build Back Better plan includes it's got to be the most sweeping nationwide measure to date to limit out-of-pocket co-pays for insulin. Now, if me and my family were worried about how we were going to cover those co-pays the last 4 months, I cannot imagine younger adults and what they face. But according to the American Diabetes Association, this is the most nationwide measure to date to limit the out-of-pocket costs. This legislation creates an out-of-pocket copay limit of $35 per month for insulin. It applies to not only Medicaid beneficiaries, it applies to individuals with commercial insurance like John and my family, and it goes further even into group health plans. So I cannot overstate, I got to use my anger in the right way, but I cannot overstate what this would mean. How excited we would be for 34 million Americans today. My son can't even comprehend that. There's so many more people like him that how this would affect. The passage of Build Back Better plan, this Build Back Better plan will ensure that millions of people with diabetes will be able to afford their insulin and will not have to skip doses, ration because they don't have enough money to pay for this life-saving drug. Now we know, some states have taken measures to address the rising cost of insulin, while families still need safety, security, and certainty of knowing that our children's health will be protected now. I was not going to get emotional. Anyhow, excuse me for that. And in the future, regardless of where they live in this country, and Representative Pappas, I cannot thank you enough for making this a priority. And now let's turn it over to the Senate and to President Biden to get the job done. Thank you so much for letting me be here, and thank you for just staying steadfast with it, Representative Pappas. Thank you.
And thank you, Bevy, for sharing your story and also for your continued advocacy. And I've got to say, it's okay to get emotional. I'm emotional. We're moms, it's our superpower, right? So I want to say that alongside the insulin cap, the Build Back Better plan also empowers Medicare to negotiate prices with drug companies for a set number of high-cost drugs. And while we would have loved to see this extended to all Medicare drug negotiations, as was originally proposed, and which we know Representative Pappas champions as well, the Build Back Better plan the House passed provides a solid start to begin negotiating the most expensive and widely used prescription drugs, including negotiations for all insulin. We have with us today dairy constituent and healthcare advocate Melly Brown, who will share why this and other healthcare reforms in the Build Back Better plan are so important to her family. Melly.
Hi there. Thank you so much for sharing your story, Bevy. It's great to hear, from mother to mother, your story and how it affects you, and how what Congressman Pappas is making happen for our families. So a little bit about me. I have a son who is 10 years old with severe spastic quadriplegia, cerebral palsy. He is tube fed and on a number of medications that we fight monthly, if not weekly, to get provided for him in our home that give him the best quality of life to live to his fullest. He is nonverbal, so I am always his voice, and I have to advocate loudly for him often. So it is very important that this bill passes and we have, a little bit of a fix for experiences we're going through with Silas. A little bit about our backstory. We moved to New Hampshire about 4 years ago, and we had quite the rocky transition to getting him on the path to transitioning his coverage. Although we took every single step, there were a lot of breaks along the way that led us to see how awful the costs of prescriptions are for families if they don't have coverage, let alone having coverage. It was really eye-opening to see that pharmacies were willing and insurance companies were willing to give them medications like Ativan and opioids for very low cost, $7, $8, and something like a compounded omeprazole was astronomical, up in the 200, 300 range that we would have to pay out of pocket for until we got our coverage lapsed, until our coverage went through. So I really feel like I should be a voice for others because I know that our community really struggles with this issue. If ever there is a lapse in coverage for kiddos like mine, we are faced with astronomical costs for drugs that our children depend on to live their best life and to stay out of the hospital and stay healthy. So I feel very strongly on this issue, and I thank you so much for helping kind of patch this Band-Aid a little bit in our broken system and help us to kind of navigate this and give families a better chance at getting these much needed medications to those in need. Also for the elderly, I know my mother personally needs hearing aids and the costs for those are astronomical as well. My father as well. And the fact that they have to wait till they turn a certain age to get covered under a certain umbrella of the plan is just not okay. So I do feel very strongly, and I thank you so much again. It personally affects us so strongly, and it really helps our children live their best life. If not, we'd have to submit them or admit them to the hospital, and that is the fact that we have to go to that measure and have them pay a cost of a hospital stay versus they could just pay a small fee for a medication. It's just a broken system, and I'm so honored that you're helping us with this issue.
Thank you, Melly. And Congressman, you might recall Melly joined us for our coffee right before COVID hit, where we talked about some of these issues, and we really appreciate you carrying forward the stories shared here today and in other experiences, because as Melly said, this is something that affects every family that has any kind of prescription drug need, and we all will at some point. I'll also add that in addition to allowing Medicare to negotiate for the cost of prescription drugs, that there is a new $2,000 out-of-pocket limit for prescription drugs for Medicare. so that seniors and people with disabilities can better afford their medication, because no one should face gaps in coverage because they cannot afford those drugs. I'd like to transition now to Robin Skudlarek. Robin has been a longtime healthcare advocate. She lives in the Londonderry area. I know that the Skudlareks breathed a sigh of relief back when the Affordable Care Act was passed and signed into law, so they could move away from high cost payments and instead enroll their young son in quality, affordable healthcare coverage. And now in 2021, Congress is poised to deliver another groundbreaking healthcare law with the Build Back Better package that will continue to benefit Granite Staters. And I'll have Robin share a little bit about how that is helping her family.
Thanks, Zandra, and thanks, Chris, Rep. Pappas, for your support for both defending the progress we've already made on healthcare and continuing to fight forward until every American has the quality, affordable health coverage they can depend on. So we were very worried several times throughout when the ACA was going to be gutted. If the last president had gotten in again, they were promised to do away with it. I have a 24-year-old son who is on our plan, able to stay on our plan thanks to Obamacare. He's graduated college. And our family story is not like many others. Again, once the Affordable Care Act was passed, prior to that, my older son was not in school at all at college at that time. And so we had to pay COBRA out of pocket. That was like $700 a month. And we did that for almost a year because we couldn't, there was no other options. When the ACA passed, we were able to get him on our plan until he was 26, which was, a gigantic sigh of relief. And then, we fast forwards now, my son is 30. He's worked in the, my older son, he's worked in the, at a popular restaurant in Manchester for a long time. He's a manager there now, but during COVID, he made the decision that he didn't want to stay in the restaurant industry any longer. And he decided to go back to college full time at 30, which is we're very excited for. But he lives on his own, still working full time. But during the rescue plan, his premiums were lowered significantly, that he was paying out of pocket for his health insurance. And so that allowed him to put the money towards college, which is, again, something he didn't graduate from college when he went away originally at 18. And so that has made an entire, difference in his life, where he can afford, he has affordable health care. He had to have knee surgery right before the election. We were worried that he was going to lose his coverage if we didn't win, the Democrats didn't win. So it was we were very panicked about that, what was going to happen if he lost insurance. And then my son, who's 24, he lives out in LA, he doesn't have benefits. So he's able to stay on our plan still till he's 26. And then I had COVID very, very badly. And I now have pre-existing conditions because of that. I have asthma. I was at one point on 7 inhalers. I'm a runner, a yoga teacher. So I had none of that before COVID. And so I was panicked about all of it. So I am, again, Chris, we've talked about this. I'm so happy that you've worked so hard to make sure that we have affordable health care here. Again, I believe, just like you do, that it's a right and not a privilege. And so, again, my son is now able to, the premiums have come down so much so that instead of accumulating loans in school, he is able to pay for school out of pocket for the most part. He's almost done with his 2-year degree and then transferring to a 4-year college. And you know what, someday he's going to be a college professor and hopefully change the world in other ways too. So I just really appreciate Congressman Pappas and President Biden, the rest of our delegation who acted to pass the American Rescue Plan, lower ACA premiums, which has had a huge impact on our family. Our experience is not unique. Right now, 4 out of 5 current marketplace consumers can find a plan on the ACA marketplace for less than $10 per month. My son is 30 and we're making money, so his is more expensive than that, but it's still very affordable for him. And besides being more affordable, the provision sorry, these subsidies are made permanent, which I really hope they do, because otherwise we only have another year left and he still has a few more years left in school. It's estimated 4.2 million uninsured people will gain coverage and millions more would continue to save on healthcare costs. You know, again, these benefits are powerful. The prescription drug plan, I hope might help with me with my inhalers now that I have to be on thanks to COVID. But I know that this has made a difference. Melly and Bevy, thank you so much for sharing your stories. Again, we're all in this together, trying to just, again, make sure our kids are safe and healthy. And again, but not to the point that we are bankrupted, just trying to take care of our children. It just shouldn't be that way. It's not like that in other developed countries. And I'm so happy that this is such a, that we have Representative Pappas and the rest of our delegation, and they are doing the hard work for all of us. Thank you so much. Thanks for everybody sharing their stories. Thank you, Zandra, for putting this all together.
Thank you. And thank you, Robin, for being there for the long haul for us with healthcare reform. I know that you've been an advocate for a long time. And I would be amiss if I didn't mention that the Affordable Care Act open enrollment is ongoing right now. The deadline's January 15th. And as Robin mentioned, 4 out of 5 current marketplace consumers can find a plan on the Affordable Care Act marketplaces for less than $10 a month. And if these subsidies were made permanent, it's estimated that 4.2 million uninsured people would gain coverage and millions more would continue to save on healthcare costs. The Build Back Better plan does extend this out through 2025, and we're very, very thankful for that, and really hope that that makes it to the president's desk and is signed into law. I will say we've been working through our organization with a number of people who became unemployed or underemployed during the COVID pandemic, which is, of course, is ongoing. And it's this type of policy that has made it between Medicaid expansion, which New Hampshire did the right thing and enacted that years ago, and hopefully with some of the provisions in the Build Back Better plan to encourage the 12 states that are remaining to put that into place. We're moving towards getting every American the quality, affordable healthcare coverage they need. And I cannot stress enough that the Build Back Better healthcare provisions are the most, the expansive strengthening of the healthcare policy in our nation in the last decade since the ACA, and if you took that out for decades before. So this bill has a ton in it that we're very, very excited about. So with that, I'll go ahead and open it up if there are other questions. If members of the media have questions, you're welcome to put them in the chat or the Q&A function, or raise your hand. And for others here, if you have other things you'd like to add, or Congressman Pappas, other things you'd like to mention about the plan.
Well, I think we covered most of the highlights, but thank you to Bevy, to Robin, to Melly, for talking a little bit about your own experiences, and to John, to Silas, Robin, to your kids. Thanks for including them as part of this conversation too. Hey, John, it really makes a difference. And I think this is really what is helping to move the needle here in Washington, where we can finally take some additional steps to make sure that healthcare is affordable, that prescription drugs are within reach of individuals and families who need them, and that ultimately, we're giving families some peace of mind. I think that's what this bill represents. This allows people to pursue the path that's recommended by their doctors, to be covered, to get better, and to make sure that it doesn't break the bank. And I think that's something that we should be providing for families in this country. That's not too much to ask here in the United States. And so I'm really hopeful that this bill gets done soon for all the reasons that you helped articulate. So thanks for being a part of this conversation.
And I will add that these are incredibly popular provisions across the Granite State and across the country. We have seen polling. We know prescription drug costs are a problem for every family. So thank you again to you, Congressman Pappas, for really championing this. And again, you've signed on to frontliner letters, you've advocated in Congress, you've done events across the state and really listened to constituents here. So we really appreciate you going the extra mile for all of us to get this done. Okay, well, thank you all for joining us.
No, that's true. Zandra, thank you too. And hope everyone has a great holiday season and a nice weekend coming up too. But it's great to see you all.
Thank you so much. Happy holidays, everybody.
Thanks.
Stay well. Thanks,
Bye-bye.
Chris.
Stay
Thanks,
safe.
Sandra.
Bye all.
Bye. Bye.
Yes, thank you, Sandra, and thank you for Granite Progress